The weather may have been mild, but for the NHS, this winter has been brutal. People are waiting longer to be seen. There aren't beds for those that need them, and those who work in the health service say it's under strain like never before. Tonight, emails leaked to Newsnight lay bare the extent of this winter's NHS crisis. We've obtained emails written last week by senior managers at 2 NHS hospitals. They tell a story of hospitals running out of beds and the despair of those trying to sort it out. This is Bangor in North Wales. The A&E here was upgraded last year, but last week the Clinical Director for Medicine for the Health Board, Dr. Mark Payne, wrote to colleagues. He said,
"Today is the worst start to a day in the 13 years since I started here. Today, of all days, consultant presence is needed on every ward to ensure anyone who can go home today goes today and goes early. That means anyone who does not have a medical need to be here over the weekend. We will have to be risky, but the consequences of not doing this are certain to be worse."
It's a chilling picture, but not a unique one. This is the Royal Oldham Hospital just outside Manchester. Newsnight has seen an email from the Director of Operations here, Dan Grimes.
"We are currently facing the prospect of going into this evening having run out of beds for any patient with a decision to admit after 5 p.m. This is one of the worst predicted overnight bed positions that I've ever known in any hospital throughout my career."
Newsnight understands doctors here are worried patients are being discharged before they're ready or have somewhere suitable to go. Local GPs have also expressed concern they're seeing harm as a result, with one GP raising the issue with the coroner and medical examiner.
In the community, we're hearing from GPs who are having to pick up the pieces. Doctors are taught to first do no harm and to have support when they're looking after patients in the community. So patients are being discharged into the community earlier than they should be. There's an open admission about that being described as risky by the chairman in North Wales in one of the hospitals.
Patients shouldn't have to wait longer than 4 hours in A&E, but the percentage that are seen in time has been falling and is now falling fast. In the 3 months to November, over 1 million people waited over 4 hours in England. But this is about more than that. It's about patients who the hospital now need to admit, but have to wait over half a day to get a bed. There was a time when almost nobody waited more than 12 hours for a bed. But look at what's happened in the past year. Between October and December last year, over 4,000 people waited more than 12 hours in England.
I think this is a very difficult situation for hospitals and for hospital staff to be in. They will do their best to make sure that every patient is getting the care that they need. But when emergency departments are working under the pressure that they are, it is harder for them. And we've seen in other hospitals, we've seen communications to doctors saying that they will be supported in taking the least worst decision for their patients. That's not a comfortable position for any doctor to be in. So people will absolutely do their best, but it is a very hard place.
It's perfectly normal for senior managers to communicate to staff about the pressures their hospitals are under. But what is unusual is the candour about the extent of the challenges they're facing.
It feels to me as though the whole system is broken. There are far too many people who are forced to hospital who can be better cared for in the community, but the support is just not there for them. There are older people who need help on discharge to make sure they get the care at home, and that's not there for them either. And so, if you want a health system to work, you've got to look at the whole system. If I reflect, this A&E department was built to accommodate just over 200 people, but at peak times, it's about 400.
Over the past few years, we've seen emergency statistics get worse. But this leak gives us a window into the difficult conversations and choices behind those numbers.